Hi, Daniela here with Potomac Medical Aesthetics. I am Dr. Petropolis's patient care coordinator, and today we are going to be talking about treatments that can address acne scarring, specifically PRP with microneedling, and how that treatment can work very well to diminish acne scarring for all skin types. So, Dr. P, can you talk about that a little bit, about some of the pre and post care and some of the concerns that patients that have maybe a Fitzpatrick 4 through 6 skin type, what can they do when they have acne scarring?
So, acne scarring is a condition that affects so many people, and it's really hard to treat. So, the biggest thing that we would love to get patients to do is to first try to prevent those scars from happening. But once they do occur, then we have to address the underlying issue, which is essentially scar tissue formation. So scar tissue formation is what is the result of the acne inflammation during the time that you have a pimple or an acne lesion. So skin types 4 through 6, which are darker skin types, my type of skin type all the way through African American skin types, they're more challenging to treat because you can't use laser and light energy to the same degree that we would use somebody with more fair skin. The complications arise and the benefits are lower. That's where microneedling with plasma becomes a really nice alternative to treat these type of scars. So what we're doing is we're making tiny little micropunctures without generating heat and then bathing the skin with the patient's own plasma, which has tons of growth factors in to stimulate new collagen growth and to remodel the existing acne scar, to help build it up and to minimize the appearance of those scars. Works very well and is a great alternative to those patients who can't get laser or light therapies because of their skin types.
So, how many treatments would an individual need, and what kind of improvement in the scar can they expect to see?
So that's highly variable, but I would say as a rule of thumb, the first thing I'd want to do is to examine the patient to see what type of scarring they have, because there are some acne scars that are super deep and they're rolling scars or fixed scars where maybe their best bet might be to do something like an injectable first, something called Bellafill, which is injectable collagen, and then follow it with microneedling with plasma. So if someone's scarring is really deep, it's a longer road to improvement versus somebody who has milder scarring. So somebody who's got deep scars can undergo some injectable collagen, and then we might try around a 3 to 4 type of series of microneedling, wait and see what the results look like a couple months down the line, because it takes about 2 to 3 months for that PRP to kick in to generate the new collagen, but they may need more. Somebody with less might need a series of 3 to 4 treatments every 4 to 6 weeks or so, and that might give us somewhere in the neighborhood between 30 to 70% improvement, and it might correct some of the underlying pigmentation or redness, which makes the scar more visible. So not only are you correcting and improving upon the depth of the scar, so if it's like a little pothole and we're getting new collagen to fill it in and make it smoother, some of the pigment within the scar and the redness from the chronic effects of the acne may improve with the microneedling with plasma to make a less of a visual impact in addition to the filling of that.
So, what is the pre and post care like for someone that's wanting to get microneedling to address scarring or pigmentation?
So that's variable also. So darker skin types, if we're going to be doing any sort of procedure like that, especially if they've had any sort of maybe a little bit of post-inflammatory hyperpigmentation with other procedures, we would probably prescribe a gentle cleanser, an antioxidant in the morning to minimize pigmentation, as well as the proper moisturizer and sunscreen with sun avoidance. Zinc and titanium sunscreen, perfect. In the evening, we might couple a cleanser with a little bit of retinoic acid to help prime the skin, to exfoliate the skin, and to help build collagen, and maybe some hydroquinone as an anti-pigmentation effect with moisture. So that would probably be a 2 to 4 week run-up. Right after the procedure, we would say we're going to stick to a very specific protocol of a very gentle cleanser, the elastin skin nectar, and sunscreen. And then about a week later, resuming their normal skincare. And the aftermath of the microneedling is typically about 48 hours of redness and dryness. And I would say 90% of patients are fully back to normal within 72 hours, actually more like 100% at 72 hours. So it's a very mild aftermath, but the post-care is very simple. Cleanser, elastin nectar, and some sunscreen if anybody goes out in the sun, although we recommend avoiding the sun as much as you can until about a month afterwards.
And are there any patients who would not be a good candidate for this treatment?
I think that the patients that I would probably steer clear of are those who have really deep scars, who have difficult expectations to meet. So if they think that one or two treatments is going to make their skin baby smooth, and I can sense that, that's probably the patient that worries me the most, because I may not be able to fill their expectations. From the medical perspective, those who have had any sort of complications associated with microneedling, which is pretty rare, but every 1 in 100 really dark patients might have a little bit of post-inflammatory hyperpigmentation, even with a very mild procedure, but we would couple the benefits of the acne scars versus that. Or if somebody has active cold sore or active acne lesions where an active infection on the face would preclude treatment at that time, and we would delay it until those had recovered or had been treated.
Perfect. So if microneedling with PRP sounds like a great treatment to you, we've got a link right below this video. You can click that, contact our spa, and we would be more than happy to set up a complimentary consultation to give you a customized consultation to find out if microneedling with PRP can work for you.